Next month, he will begin his anesthesiology residency training in San Diego, California. Please welcome soon-to-be doctor, finally, Peter Wingfield to the podium.
That was going to be my punchline as well, that I'd been to medical school before. Now you all know. Dean Morin, distinguished guests, faculty, friends, family, doctors. So I would be remiss if I did not acknowledge the irony of my standing up here as the representative of the class of 2015. As you all know, I started my medical training back in England straight out of high school, which is how they do things there. And that was the 8th of October, 1981. To say that that is before the vast majority of you guys were even born would be just acknowledging the blindingly obvious. For most of you, the glint in your parents' eyes was still on a far-off, distant horizon. And for Dr. Ng and Dr. Meredith, who would not actually be born until the 1990s, their parents probably still had training wheels on their bicycles. It's taken me close to 35 years to get through medical school, which is slower than most of you, probably slower than anybody in history. So how could I possibly be representative of anything at all? Stick with me, because I think I actually do represent our year in a hugely significant way. So there's this thing that happens. And I never noticed it until I started mingling with medical students from other schools. So as the organization of student representatives guy for our class, I get to go to national meetings, regional meetings, and I would find that I would meet medical students from other schools, and there would be this momentary pause and a slight tilt of the head, and this almost imperceptible sound, a sort of sound. And it took me a while to understand what was going on. And I finally realized that what they were doing, they were looking at me, and they were thinking, why is this guy who clearly is not a medical student pretending to be a medical student? Hey, what's the twist? I don't get it. And then you could see them consider it and realize that fundamentally, there was actually no reason at all that I might not actually be what I was claiming to be. And they would reset their parameters, and we would move on. And they do that very quickly, very efficiently, because they're all smart and culturally competent, but they would do it nonetheless, and I would see it. And that made an impression on me, because I'd never seen it here. The class of 2015 always treated me as no more and no less weird than anyone else in the year. And that may seem like a trivial thing, but I actually think it's profound and emblematic of something incredibly special about this medical college. Everywhere you go, schools will tell you that they look at the whole applicant. But at UVM, they mean it. And the diversity of our year is a reflection of that. And I don't just mean diversity in the sense that is frequently used. I mean experiential diversity, experience of life. We have an extraordinary group of people in our year. There are members of the year that came straight from bachelor's into med school, and there are members of the year that had a gap in between and did something else. There are members of our year who were wanted by every school they applied to, and there were a significant number of us who struggled to find other places that were willing to take a risk. And I include in that group someone who walked away with almost every single prize at the awards dinner a couple of days ago. Apart from, ironically, the Dr. James McAvoy Prize for being James McAvoy, which surprisingly went to Dr. Frizzell for getting an almost perfect score in the neurology shelf exam. You know, we have amongst us, we have a former bus driver, Dr. Cunningham. We have a former ballerina, Dr. Landell. We have a Bosnian war refugee, Dr. Poljak. We have a professional baby cuddler, Dr. Evangelista. You know, we have everything from farmers to financial analysts. We have a TB instructor in Nairobi to a Special Olympics ski coach. We have gay and straight. We have married and single. We have parents and pet owners. We have Muslims, Jews, Christians, Hindus. We have 17 languages spoken, although I believe that Dr. Shah accounts for 6 of those on his own. You know, we have a student who was followed around by her own personal signing team throughout the 4 years, Dr. Abernathy. And we did, of course, also have a student with his own personal fan club. It is no surprise that I never had that moment here, because this school chooses people that have openness and empathy in their DNA. It's what we are made of. You know, I think that one of the biggest challenges in medicine right now is dehumanization. And that's for patients and for practitioners. You know, it's really hard to just walk into a room and see the patient that is sitting there in front of you, because we're trained to categorize everything. And you know, we have to in order to function. So we look and we say, if you are this age and this sex and you have this story and these symptoms, then what is most likely to be going on? Which box shall I put you in? Medicine has always been, to some extent, like that. But I think what's changing is the algorithm that then follows. If you're in this box, we do this. If you're in this box, we do that. There is a computerization of thought and action, a digitization. It's absolute. You know, it's on or it's off. It's yes or it's no. And there is value to that, but what risks being lost is the answer to the really hard question, which is, this person in front of me right now, what is it about them that makes them different from the box they're in? What is it that they need, that they want from me that isn't in the algorithm of best practice? And in order to answer that really difficult question, you first have to see them without distraction. Without being distracted by race or age or gender or educational background or anything else. And we have that skill. I trust that it is in me because I would not be part of this extraordinary class if it was not. And I know that it is in you because I've had the great good fortune to be on the receiving end of it for the last 4 years. And don't get me wrong, I don't think it's just going to live in blissful tranquility inside us. Because as Dr. Macaulay has told us on multiple occasions, medical school is really good at destroying empathy in people. And if it survives that, there's still internship and residency and the electronic health records. But I urge us to remember that it is still there in us. Even when we don't feel it or we're too dog-tired to express it, it will still be there waiting for, as Dr. Rosen might say, a little mindfulness to nurture it back to life. It's what made us standouts as applicants, and it will make us standouts as physicians. My friends of the class of 2015, I wish us all incredible careers that we could barely even dream of right now. I'm anxious and excited to see where the road leads next. It has been an absolute privilege to be a part of this class and of this College of Medicine. Let us go into the world and show them what doctors from the University of Vermont are made of. Ladies and gentlemen, I give you the class of 2015.